Hello, I'm Paul Zaychuk, founder of Elastic Steel, method of athletic conditioning. Today I would like to talk to you about something that might interest you if you're a martial artist and you have back pain. There's many reasons for back pain. There's many different types of joints, many different types of muscles, certain organs, infections, a lot of other reasons why somebody might have back pain. However, if you're a martial artist and you have back pain specifically in one side, and it's a muscular pain, it's not pain in your spine, it's a pain in the muscle, there's a number of reasons for it. And today you might find out why you have it and possibly even how to correct it. Now, the muscle I'm going to focus on is Quadratus Lumborum. It's a muscle that flexes the spine to the side. Now, many martial artists use that muscle, or rather overuse this muscle, when they perform the kicking techniques, if another muscle is weak, or if the technique is incorrect. The reason I decided to make this video is because of something happened not too long ago. A martial artist, a Taekwondo practitioner, had back pain. He wasn't sure what the back pain is, what is the cause of it, and what exactly was the back pain. MRI did not show much, and his martial arts instructor told him to stop kicking at all, and he stopped kicking. He stopped doing a lot of exercises, including all kind of deadlifts and hyperextensions or anything for the back. After a while of not working out, first using rest and ice and then using heat, his back pain became a little better. When he came back, his martial arts instructor reasoned that the pain is probably due to sideline kicks, which is not far off. Although he didn't know it was Quadratus Lumborum, he realized that the pain is caused by flexing to the side, and flexing to the side happens when you throw sideline kicks. Like a roundhouse, hook kick, your body flexes towards the kick inside. Quadratus Lumborum is one of the muscles that flexes the body to the side, either way, left or right. So he stopped working out. Once he came back, he only stuck to the front kick, axe kick, inside and outside crescent kick. When that was happening, the pain came back. So why did the pain came back? If he wasn't flexing to the side anymore, and that muscle is not supposed to be working, it's not supposed to be irritated. Well, when I tested him, I confirmed that it was Quadratus Lumborum on his left side, and it was actually full of trigger points and it was very sore. Well, there's three main reasons why somebody will have, a martial artist especially, will have Quadratus Lumborum pain. Okay? Overusing the muscle, that will take over for the obliques and abdominals to flex the body to the side as possible. In his case, that wasn't happening, especially since he wasn't throwing sideline kicks for a while. He was only throwing front line kicks. So I looked at it, and this is what happened. There's three reasons. One, lack of flexibility in the hamstring of the kicking leg. Two, lack of strength in quadricep and hip flexors of the kicking leg. And three, weakness on the opposite side in the abductors. So, this is what happens. When a front kick is thrown, the hips are leveled. However, if there's no flexibility in the hamstring, the only way to kick is to lift this hip. If there's no strength, the only way to kick higher again is to lift this hip. But that wasn't his case. His case was the third problem, the abductors on the opposite side. Notice, you lift the knee, your hips are leveled, you place your hand here, your abductors are tight, you will feel it, like a rock. However, if they're too weak, they can relax if you do this. If you lift this hip as high as possible, the abductors here, gluteus medius, gluteus minimus, also tensor fasciae lata, a little bit of gluteus maximus, they relax. Okay? So, to take the pressure off these muscles, you lift this hip. And this is what he was doing. Every time he would lift this hip, the Quadratus Lumborum on this side would contract, 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 overdoing it. This muscle wasn't being used. The balance was being lost. So, this is what we did. First, we took care of the trigger points in the left Quadratus Lumborum. We stretched it, we got it back to normal. The second thing that we did was took care of the trigger points in this muscle. And the main reason it was weak because of the trigger points. But once I tested it, it was weak after the trigger points, not as weak. So the next thing that needed to be done was to strengthen the abductors in the opposite side. To strengthen the abductors, we used a resistance band to move the leg out to the side. We used pretty heavy resistance. Once we were able to move the leg out to the side very well, a little bit in front, a little bit in the back, and directly on the side. We started standing on this leg, keeping the hips leveled, slightly moving up and down, moving the hips up, moving the hips down, staying on one leg, making sure that this muscle can handle it. Lifting the opposite knee, making sure that this muscle can handle it. Notice that my foot is right now is not on the side of my body, but it shifts under my body, so the center of balance can stay normal, and then this muscles take over. The weakness in this muscle, of course, was causing this to happen. So once this muscle was torn, and he learned how to stand with hips level, he began throwing the kicks without any issues. So if you have something like that, if you have pain on the side of your body, and you know that it's not the spine, you know it's not the discs, you know it's not a sciatica running up or down your leg, on the back, on the side, on the front, and it's actual muscular pain, at some point it could lead to problems in your spinal disc. It could lead to a lot of other problems such as sciatica as well. But if, for your point, at this point, you know that it's a muscle problem, then I do not recommend that you do what I just told you to do by yourself. I recommend that you seek a practitioner. But what I'm showing you right now is basically where it's coming from and how to take care of it. In case your practitioner has no idea how to work with it, maybe you could recommend it to him and work with him together to take care of your issue.